going to talk about important things like screening programs that we really all should know about, and we'll probably know a little bit about, but as we move through life, different screening programs do come into play. And it's not just about the screening when we get to, for example, with breast screening, when you get to 50, it's about being breast aware, knowing how to examine your own breasts, because even though it's quite uncommon to get a breast cancer earlier on in life, it is quite common to have lumpy boobs, and just so that you know what you're looking for, how to look for them, and then what to do after that. And then I'll talk a bit about the breast screening program. I know there'll be people here who haven't reached the age of 50 yet, but you know, you'll remember it for that time. Literally, I turned 50, and by then 2 days later, I had a letter on my doorstep from a breast screen. I was like, that way gives a chance to settle in. I think it's a bit cruel, isn't it? So now I just did this presentation last night, so bear with us. I'm sure it will make sense when we go through it. So breast cancer in the UK. It's more common in women than men, obviously, because we've got more breast tissue than men do, but 55,500 women and 370 men are diagnosed every year in the UK. That's a horrific amount of people, isn't it, really, when you think about it? And 1 in 7 women will develop breast cancer at some point. I mean, so how many of us is in here today? 14, 15? So 2 women in this room will develop a breast cancer. Oh, that's just made us go a little bit. You know, when I look around at the faces and just think it could happen to any of us. And it is the most common cancer in the UK, in men and women. And that's frightening as well, really, when you think about it, isn't it? And 15% of all new cancers diagnosed in the UK are breast cancers. Just makes you want to chop them off, doesn't it? And just think, let's have done with that. So that's just giving you a little bit of an idea of the magnitude of it. So one of the good things about breast cancer, if there is such a good thing about a cancer, is there's lots of modifiable things that we as individuals can do for our own health to protect ourselves from breast cancer. We can't always take all of the risk away, but we can reduce the risks that we have now. I know we'll laugh about having a drink and things, and we, you know, most of us will have a drink, you know, but drinking alcohol really increases your risk. And I'm not pointing fingers, and I'm not I'm honestly not judging anybody, because I'm probably one of the worst ones for that, being overweight or obese. And if we're going into menopause and midlife overweight, we are more likely to develop breast cancer, you know. But if we don't know that when we're younger, how we end up at this age, and you put weight on and you've kind of missed that opportunity. So, you know, this is stuff that younger people should be getting told. Do these things when you're younger, and you're going to reduce your risk as you move through life. The contraceptive pill and combined HRT increase the risk very slightly. Okie dokes. So we're not going to get too hung up on those ones. With the contraceptive pill, when you stop taking the contraceptive pill, your risk goes back to normal. And if I remember correctly, so it does with combined HRT as well. But you'll see on the next slide the risk, you know, how many more people will be at risk from each. And being inactive, you know, not doing any exercise. And I know most of you by sight, and I know most of you do some form of exercise, whether it's your gardening, swimming, you know, I know bikes and things like that. So keeping active is a really great way of reducing your risk of breast cancer. So now these are the breast cancer risks that you can't change. So we've got all of those that we can change as an individual, and we've got all of these that we can't change. So getting older, obviously, the more you've been around, the more your cells can change. Family history and inherited genes, we all know about BRCA, and I'm sure we've all had conversations with people who've been told they can't have HRT because the cousin thrice removed had breast cancer. X-rays and radiotherapy goes without saying, that does increase your risk of any type of breast cancer. But if you need an X-ray or you need radiotherapy, you need an X-ray or radiotherapy. Diabetes increases your risk, but again, I mean, I think that's a bit of a crossover, because we know that your risk of type 2 diabetes is reduced if you lose weight and if you're active. So that's kind of like a one. Dense breast tissue and benign breast disease. If you've got lumpy boobs and if you develop cysts in your boobs, you can't do anything about that. If you've got dense breast tissue, you can't do anything about that either. Age when periods start and stop. Now, I found this one really quite interesting, because you don't even think about that. And not having children or having them later in life. I mean,
Can I just ask about the bit when your period starts? How does that affect it?
I think it's the younger you are when you start your periods, the higher risk you have of developing breast cancer, and it's probably because your hormones are developing earlier, and it's pretty much the same when we go on to the cervical screening one. A lot of these are kind of the same, but some of them are different. For example, on the cervical screening, having children when you're young increases your risk of getting cervical cancer, but not having them increases your risk of breast cancer. So you're damned if you do or you're damned if you don't, really, aren't you? So, I mean, white women have an increased risk. I don't know why that is. It may well be lifestyle, but I don't know why that is. Previous cancer goes without saying. If you've got faulty cells, you know, they can develop anywhere in the body. And taller women, I mean, what? So all those 5'2" people out there, well done. You know, something to be said for being small. But it's quite amazing the things that you can't change that will increase your risk. And I think that makes it even more important to think about the things that we can change as individuals to try and balance that out. And the jury is still out whether diet and smoking. That's another thing that blew my mind, smoking. I mean, you would just think smoking's bad for everything, but apparently there's no evidence to suggest that it will increase your risk of breast cancer. And diet, eat what you like. It's going to make no difference. But no, that's not true. They don't know whether it makes a difference or not. But then you put that against you being active and you're being overweight, and again, it's one of those balances, isn't it, of how you're going to manipulate that. So I know that's not very big, but this is one of my favourite breast cancer risk things. It's from the Women's Health Concern, and it shows you 23 out of 1,000 women will get breast cancer, regardless of anything. That's a baseline. Okay, so additional 4 cases of women who are taking combined hormone replacement therapy. It's not bad at all, is it, really? If you think 23 women are going to get it in any way, and 4 more will get it. And for me, having my HRT balances that out for me. And estrogen-only HRT reduces it by 4 people. It's a bit crap if you've got to have the progesterone, because you're damned if you do, damned if you don't. And again, the same risk on the combined hormonal contraception. Additional 5 cases in women who drink 2 or more units of alcohol a day. Put my hands down. I'm not going to ask anybody to volunteer the information there. 3 more, now you see this says 3 more cases in current smokers, but that's not really very much at all, is it? But look at this, an additional 2, you're twice as likely to get breast cancer if you're overweight. So that goes from 23 plus another 24 with a BMI of over 30. So this is the biggie, really. And it's so hard, isn't it? And especially when we're getting to middle age, it's really hard to lose that weight. I mean, I think we all feel that, you know, you exercise, you try to eat right, but, you know, it's mind-blowing. And then this one, I can't even see. I think I need different glasses on. Can you edit this bit out, please? Yeah. Can anybody see? I literally can't see what it says. I know. Wait a minute. Oh, this is about exercise, right? Okay, so 7 fewer cases of women who would take at least 2.5 hours moderate exercise a week. So if we take that minus that, plus that, you know, it's about balancing risk, isn't it? So if you do a bit of exercise, it'll kind of balance out a little bit more. You have to I think it's the yellow writing. I can't see the yellow writing. Right, so the breasts. We've all got them. Okay, so this tells you a bit about what the breasts are made up of. Fat. Some of us have got more of that, some of us have got less. Glandular tissues, okay, so they're in the lobes here. And the milk ducts, because we all know our breasts are predominantly for breastfeeding. The young. I wonder if that's why people who've never had children are more at risk. Because if they haven't had, you know, if they haven't breastfed, something I really need to look into, and some fatty tissue, lobules and lobes. Okay, so the duct spread from the lobes towards the nipple, obviously to get the milk out. Okay, so that's what a healthy breast will look like. Don't worry, I haven't got any horrible pictures of horrible breast cancer breasts. I promise you, I'm not going to do that to you. And I really like this one because I think sometimes when we think of breasts, we think about just your knockers, don't we? This bit here. But look, when we're doing a breast self-examination, we need to be going all the way along the lymph nodes. So I think that really demonstrates where it should be. Okay, so your lymph nodes, I'm sure you're all aware, they are part of your immune system, and the fight infections and keep everything moving and keep fluids going through the body. So they are important, and women often who have breast cancer will have to have the lymph nodes removed, and you might have seen them where they've got kind of stockings on their arms for lymphedema, just to help to pump the blood back up, because they don't have that support anymore. So yeah, I really like that one. So there, that's what I think. So breast self-examination. I'm not even going to ask who does it, because I think we all do it in some way, shape or form, whether we're doing it formally or whether we just do it ad hoc when you're in the shower. I think, oh, what's that? Partner might do it. We get a lot of women coming into the surgery. My boyfriend, my husband said they felt a lump that I hadn't felt, you know. So how you do it. So in front of the mirror, standing up, lying down, or when you're applying body lotion. So any time, okay? It's important to think of your breasts, of how they are and how they lie and what changes. So when you're standing up, they feel totally different than when they're lying down. Putting your hand up stretches your breast tissue out so you can feel more and you can feel around. Now I've got these really lovely boobs over here. Okay, so I'll pass these around. So just going around. So what I would tell people to do is put the hand up above the head like that and kind of feel all, and use the flat of your fingers. Don't kind of push in like that. You want to use the flat of your fingers so that you can feel anything different. Okay, so you're just going all around there. Okay, and then you would do the same on the other side. All right, and going around in a circle, see if there's anything that you can feel there. All right, there's no hard and fast way to do it. Look, see if there's anything abnormal about it. Get to know your own boobs is the key thing. All right, only you know what your boobs look like on a particular day. So many times women come in and say, I think I found a lump. Well, you know what your boobs are like. I've never met your boobs before, so you can come in and I can have a feel of them, and it's the first time I've felt them, so I don't know if that's normal for you or not, especially ladies with lumpy boobs. So try and get into the habit of doing it just once a month at the same time of the month, especially if you're still having a menstrual cycle, because as your hormones go up and down, your breast tissue will change. When we were younger, we maybe got sore, swollen, tender boobs just before you were going to have your periods. So it's no point in checking it at the beginning of your cycle one month and then the middle of your cycle the next month, because you're not comparing like with like, you're comparing with apples with oranges instead of apples and apples, or melons and melons. Okay, so and that's all what it says on there. So looking at the boobs, and what we're looking for is anything like skin puckering, any changes in the colour to the skin, any changes to your nipples if they're normally sticky out and one of them's pushing in, anything, just anything different. And as a clinician in a GP surgery, if a woman says, I'm worried about my breasts, I bring her in and we have a feel and we refer. But I'll get to that bit later. So never be worried about getting in touch and just saying, they just don't feel right, or this doesn't look right. All right, so looking for anything different. So you might get dimpling, where there's a tumour underneath that's pulling the skin. Okay, so you might find it easier to use a mirror and looking with your arms raising from both sides, and then do the feeling. Have a feel. or get somebody else to have a feel. Some people like doing it when they're in the shower, when their hands are soapy, because it moves easier across the skin. Okay, otherwise you kind of dragging it, but I think most of us have already says we're pretty sweaty at the minute, so everything just slipping all over everything without any body lotion, isn't it? Okay. What was that?
Slide and glide.
Yes, well, totally different. So nipples. So anything from your nipple that's not normal, any discharge or bleeding or fluid coming from one or both of your nipples, anything that's not normal for you. If it's itchy.
Since I started HRT, I've got an itchy left nipple, girls. It's just like I could ride it off.
It's probably just because of the increase of estrogen.
Like, you know, when you just like, oh, yeah. And it always happens when you like talk with your boss or something.
Yeah, can we do this phone call? There's over a phone call. Just so I don't have to itch my nipples. So, but yeah, you know, if it's crusty or anything like that, so looking for skin changes as well. Try a bit of hydrocortisone. If you've got an itchy nipple, try a bit of hydrocortisone cream or something and see if that settles it down. If it doesn't settle it down, then get it seen. But, you know, if it's itchy and you're worried about it, get it seen. You know, and our breast clinics accept everybody that was sent. I have never had a breast referral sent back, whether it's somebody who said they've got painful boobs or this, that, the other. They'll see everybody because they're canny like that. So I like this one as well because I think it demonstrates a bit what every different part might look like. So know your lemons. Can you tell I just did this last night? So what to do if you are worried? Seek medical help. Phone your doctors, put an e-consult in, just say, I found a lump, I've got nipple discharge, whatever, and you should be seen, I would say, within the week. Okay, it's not a blue light emergency, get you in, but you really want to be seen quite quickly so that they can get you referred in. Depending on your surgery, they might make you a telephone triage or a face-to-face. If you have a telephone triage, they're going to bring you in anyway. So ask for a female if you're more comfortable. But remember, doctors and nurses are professionals and they don't care because you're just you're a pair of boobs that's coming in with a lump. You're a body part. That doesn't sound right. But, you know, they're not looking at you as a sexual being. These aren't breasts that are there for any other reason than to be examined for a medical purpose. And don't forget, you can ask for a chaperone. If you feel uncomfortable having somebody, man or woman, examining your breasts, you can always ask for a chaperone. And you can ask for that when you book, or you can ask for it when you go in. You know, if sometimes you just get a vibe about somebody, or you don't gel with somebody, but you can always say, "Can I have a chaperone, please?" And most of the time, a clinician will offer you a chaperone. And normally people go, "Eh, God, no, I don't want everybody looking at my boobs." Pretty much, that's what people say. So, what will happen? I don't need to read everything out on there, you can read it. So it's pretty straightforward. Ask you some questions, have a feel of your boobs. If you can remember where the lump is, it's great. If you can't, we'll have a feel. And even if we can't feel it, we'll usually just send you in anyway, because if you felt it, it might just be the day or whatever. We'll just send you for a 2-week wait. If you're over 35, you'll qualify for a 2-week wait. However, most breast clinics will see people within 2 to 4 weeks in anyway, regardless of your age. So just because it's more common to get breast cancer when you're older, doesn't mean that if you're younger, if you find something, that you shouldn't get it looked at, because prevention is better than cure. So I don't know if anybody's ever been to a one-stop breast clinic. Yeah, it's dead easy. You go in, they squeeze your boobs and they do a mammogram, they do an ultrasound scan, you go and see the consultant who goes, honestly, pretty much that, because they've got all the information from the mammogram and from the ultrasound scan, so they have a bit of a feel, and then yeah, you're fine, off you go. Did it not? Well, I think no. I think you should get in touch with pals and complain that you didn't get a when you had your breast examination done. So it might just be mine. Might just be in my head. And you never know, do you? So we do have the National Breast Screening Programme. I think what's important to say about screening programmes is they are screening programmes. That don't ever sit on a lump because you're going to have a mammogram in a year's time. Screening programs are to pick up things that wouldn't normally be, that you haven't noticed yourself, okay? So every woman over the age of 50 is invited for breast screening every 3 years. Now, some places around here, because we are kind of like very far away from the University Hospital North Tees really, they'll send a mobile breast screening unit out, so you might not get, like there must have just been in Peterlee when I turned 50, because I got mine straight away, but you might get yours when you're 51, if that's when they're in your area next. But you can always phone that number there, and we'll put this on the Facebook page, and if you think you're overdue your breast screening, you can always phone up and say, I think I'm overdue my breast screening, can I make an appointment? Okay? It's not as bad as people think that it's going to be. And the women, I'm sure I'll put this on the next slide. So what is a mammogram? It's an x-ray. It's basically an x-ray of the breast tissue. So they take one that way and they take one that way. And that's it. So you're standing. Yeah, I think it does.
My friend's got virtually more boobs than her ears.
Yeah, because they've got a kind of, whereas mine is just from mine present themselves.
Never stop me going. Never stop me going.
No, but it's the same as anything. Sometimes we don't want, you know, it's not the most pleasant thing, but I think what you have to remember is
I was just thinking, I shared it the first group and was, you know,
No.
But I've got implants. So when I went for my mammogram, they had to lift my implant up to get under. Now that was painful. They literally did lift my implant up. But do you know, they do it within seconds.
Yeah. It takes hard, because they're so skilled at what they're doing. It's not that they're trying to find the right position, because they know exactly where they need you. And the women that I had was so pleasant and efficient. They just got on with it, got it done. Absolutely, yeah. Took us longer to take a selfie on the breast. Yeah. Took me longer to do my selfie outside the screening truck than it did to get my examination done. Wish I was as good as them. I mean, honestly, if you haven't reached the age where you're going to have breast screening, it's really nothing to worry about. And it's looking after yourself. And as we always say in this group, we have to look after ourselves, because at our age, in our midlife, anything from 40 onwards, we've probably got another 40 years left to live. Great.
I think I got something through before 50 as well, because they had a...
Yeah, they had a pilot on. Yeah. 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 I'm not sure if that's still running, but it's 50 when 50 is the official. So you should get your results within 2 weeks, and the radiographer will tell you. So if you have a normal result, you get your letter to tell you your mammogram's fine, see you in 3 years, and then you get another letter in 3 years' time. Okay? So contact you. It says contact your GP. I've took this off a website. Don't contact your GP. Just contact the breast screening people, because all we're going to do is give you the telephone number for the breast screening people, because we've got absolutely no jurisdiction over them. But again, it's important to see somebody at the surgery if you notice symptoms in between your screenings. Don't ever put it off because, oh, my breast screening's due next week. Okay, there is a I'll just grab this thing here, because I found this quite interesting. So this shows you what size your lumps are when they can be detected. So this is the average size of a lump found if you have your regular mammograms. So tiny. Okay, so if you go for your 3 yearly mammograms, they'll probably find a breast cancer when it's that size, when it's small. Average lump found on your first mammogram. Okay, I have got, actually, there's a bag of lumps, but I'm scared in case I lose them, so I haven't put them out, but you just can have a feel of my lumps if you want. But I didn't want to put them out because they're not my lumps, and I didn't want and I know. So this one, the next one up, is the average size lump found by a woman who's doing your regular breast self-examination. So that's probably what, about the size of a 5p. So that's, I don't even, what would you say that size is? I don't know. Not even that. I would say that's a raisin, but that's kind of a tiny thing. Huh? A tiny currant. A tiny currant. So if you're doing regular breast examination, it's going to be that size before you find it. Okay? So if you do it now and again, it's going to be the size, it could be the size of a 10p. That's the average size. So if you can imagine, if you're doing it regularly, you're going to catch it so much sooner than that. And this is the average size of a lump of somebody who doesn't do breast. This is the kind of thing that we see usually at the surgery. And sometimes, especially if people are very slim or the older ladies, you can actually see the lump in the breast by the time they come in to be seen. So it doesn't matter how old you are, if you find a lump, get it seen sooner rather than later, because I'd far rather see somebody who get a letter saying, oh, they found a lump on the breast screening, than have somebody coming in that I've got to refer under a 2-week wait, because that's never a nice thing to see. So I thought, I don't know if you want to pass that around. Do you want us to pass the bag of lumps around? Here's the bag of lumps. So yeah, I think that's the biggest one, is it? Yeah, so that's the one that if somebody's not doing the breast self-examination, they just find it by accident. That's the average size of the lump. That's kind of big, isn't it? There you are. Pass a bag of lumps around. I think because we hear so much about breast cancer, we don't really think about it very much, because it's so common. It's just become commonplace, and I think sometimes we just don't connect the dots as to what it actually is. So back to the screening program, around 4 out of 100 women are called back for more tests, but many of those women won't have cancer either. Okay, so important things are regular breast self-examination and your regular mammograms. Okay, so if you call back because your mammogram showed an abnormal area, they might do a different type of mammogram. They'll probably do an ultrasound scan as well. And sometimes at that stage they might take a biopsy of it, so take some fluid out of it to see what it is. But a lot of these might just turn out to be simple cysts as well. So again, when you get to that stage, I know it's easy for me to say, but try not to worry, because I remember when I had a breast lump and I was pretty much convinced that it was nothing, because why would it be something? But you worry about these things, but always try to remember, in the majority of cases, it's not. Okay? And here's your references and resources. So there's lots of there's boobs here. Sorry for throwing a boob at you. Which one did I throw at you? What's it? Oh, has it come back? So I've literally just picked these up from the boob lady today. So this one shows where you're likely to feel, where you're most likely to get a breast lump. So this is a right boob. So again, this is in that lymph chain. Okay, so that's where you're most likely to get it. But look, the nipple's kind of like the next most likely. So we can pass that one around as well. That's a little visual representation of what's underneath the skin, with the ducts going towards the nipples. Do you want to take it around that way? And now these ones have got lumps in them. Ooh. So we'll pass them ones around, and that one's another one with.
Kerry,
Yes.
that would actually feel like that hard.
Yeah, I think you can definitely. I mean, that one, when you pass this one around, you'll feel. I mean, that one's a flat lump, so I don't know, but they are hard. And normally, if it's a cyst or something like that, they're normally less hard. But sometimes they go, oh no, please, that's not my boob. Have that one. So these ones are kind of realistic. I wish it was that big. It would make life a lot easier. But you can feel the difference in trying to feel a lump in the big one and the little ones. Would you like it?
I felt the little one actually. It's quite hard to find. It just feels slightly uneven.
Yeah. So that one's that's a benign boob. That one's got benign lumps in. So have a feel. Have a feel. So there's two lumpy ones. There's one it'll tell you on the back what it is. One of them's kind of benign, and the other one's that's a Harmson. Do you want these normal ones? These ones just kind of. What do you think it feels like? We'll carry that around here. I know, absolutely. I'd be 10 stone if it wasn't for me and my boobs. And this one just kind of encourages it to do the going around kind of thing. Lumps. Do it with the flat of your hand, so put it on the table and kind of go kind of like that. Did you find the one in that one?
Yes.
Then there's a little pea-sized one, and sometimes they're just like that. Looks like somebody's kidney stones, doesn't it? It is, it is.
I'm terrified to do it because I'm working at my time. I've had cysts before that I took out. Things as well, things always when you find themselves feel bigger than what they actually are.
And we always poke.
Yeah.
And then you're doing this all of the time. You think, e God. And so you're just inflaming it. But that's quite normal. You know, and even that couple of days while you're waiting to be seen at the surgery for somebody to, I don't know why we have to see women. If a woman tells me that she's got a breast lump, I'm referring them to the 2-week wait, regardless of what I feel, because if you felt it, then that's enough for me.
You kind of find it again, straight away.
Yeah.
And then next few days later, find it again.
Yeah, absolutely. But you know, for me, it's like postmenopausal bleeding. We don't even see them. We just refer them straight away. So I don't know why we don't just do that with boobs as well, because I know I'm going to refer you. Have you found it?
Some of these are bigger than my boobs are. Like if I mean, you'd probably
Yeah. Yeah. Well, you'll be able to see when there's another one coming around, which is it, and you'll see feel the difference between feeling them in the littler boobs and feeling, and that's the thing. It's just to kind of show you how you would go around your boob. Yeah, I don't think there's anything in that one.
these are ones like this is to show you the lymph nodes.
I can't remember. Up and down the other one is. So as long as you're covering all of the breast tissue, it doesn't really matter how you do it. Yeah.
I get ones like facial cysts where they and I'm going to them, I think.
Yeah. But lots of people do, but you know what's normal for you, so you know that if you do that and there's a little skin cyst under there, and then so you know, and that's the whole key to understand what your boobs feel like. And it is awful when you think about how many women. I mean, 1 in 7. I think that's just shocking. Should have been a sweepstakes, shouldn't it?
I could not do it. That was me feeling like I would feel whole.
Yeah, but you would know what your breast feels like, and these are the your boob. Yes. Yeah.
Oh, there it is.
Tuck it into me big knickers. Yeah, I'm not going to bother with a bra anymore. I'm just going to tuck it into me big top of me big knickers. Shall I swap them for somebody else's boobs?
Yeah, I think that's been over there,
Do you want to feel these lumps? These lovely lady lumps.
Is that the lump?
You know, it's a boob.
I can't imagine.
Some people, I know.
I was wondering how do you know?
You just know.
And it's like, well, yeah.
You would just know because you know what your boob feels
But
like.
it's sort of like what a lump would feel like.
Yeah.
You know what I mean?
So are these both bad lumps?
Yes.
What is deep?
You can't feel it. Like,
So that's why you've got to kind of do it from all aspects. I know. Well, obviously there was a bigger one going around, but I think somebody's nicked it. Oh, there is.
that's it.
Are we supposed to feel
Yes.
Getting closer.
Just, I think it's easier to feel them in the little boobs than the big boobs. And when you've got dense breast tissue, you can't, you're not pushing through just
I like
fast.
that cystic one though. A tissue by background. Of course, I like stitches.
Yeah.
But actually, if you're going to do it, you need to focus.
Yes.
Top.
Yeah.
It's the most important, isn't it?
Yeah. Well, just doing it's the most important thing.
You know what I think you should do? Every month, ask us. Have you done it? Yeah.
We should have a collective day on the Facebook page, and I'll do a little live. I'll not do my own. I'll have a boob. I'll have a boob and I'll sit. We'll do it for so. I'll go on a live. Okay, ladies, when you're in the shower today, don't forget to do your breast self-examination.
Have you checked it? Yes.
Have you checked your boobs? Right. Shall we do? Right. Oh, it's gone off.